There can be a lot of unknowns when it comes to pregnancy and postpartum. And what I strive to do is help you have a better understanding about your body and its anatomy and what is naturally occurring during pregnancy and postpartum, and then give you ways that help you manage those things. But sometimes you can still be kind of shocked by the changes that happen, and that's okay to have those feelings. Today, we're going to go over one of the things that shocked me the most in postpartum, which was how painful gas was. So, gas is a naturally occurring bodily function that happens, but after you give birth, it can be more uncomfortable, and there are 5 reasons as to why. So we're going to go over those, and then we're going to go over some really simple actionable things that you can do to help manage that. So typically, gas that may be painful after giving birth happens because of hormones, perineum or pelvic floor injury, organ displacement, cesarean incision, and lifestyle changes. So what does that actually mean? So in pregnancy, your hormones change, and that increases progesterone and decreases melatonin. And that decreases your digestion, which can lead to constipation. When we have constipation, it can cause bloating. When we have bloating, right, we have increased gas. And when we have our baby, those hormones, yes, change, but that doesn't mean that the bodily functions that are impacted by those are going to change as dramatically or as fast. So sometimes in postpartum, because of those hormone changes, you can still have some blocked up gas from constipation, and then that can become painful. So perineum or pelvic floor injury, because the pelvic floor is the exit point for our gas, if there is any injury to that area, it can become very painful for anything to exit it, especially if the pelvic floor has scarring in it, or if it is trying to guard from that pain. So just from that, having regular amounts of gas can become uncomfortable, and then what can happen is we actually then keep the gas in for longer periods of time, which means it's blocked up, we become more bloated, and then it can continue to become more painful. Okay, organ displacement. So this is essentially once you've had baby and everything has moved out of the way for baby, your organs need to find some normalcy again by shifting into positions that they were pre-pregnancy. This takes a little bit of time, and when that happens, the organs may not be functioning to the capacity that we need them to. So again, there may be constipation, or there may be a sluggish gut, or you may be on the other end. And when that happens, we can have more excess gas trapped, and it is harder for us to pass it. The next one is cesarean incision. So if you've had a cesarean birth, and when that happens, there are multiple layers of tissues cut through, as well as spread in the abdominal wall. And with your gut, when you are moving stool through the intestines, it is going to impact all of those layers. So if there is a buildup of gas, or there is restrictions from the incision, it can cause the intestines to slow down, it can cause more gas, and then this incision is sensitive, and that can cause more pain. The last one are lifestyle changes. So after giving birth, your diet may change, your movement habits may change, and that's not necessarily a conscious thing. It just happens because now you have another human being to pay attention to. You are healing, and both of those things, change in diet and change in or reduction in movement, can reduce how your gut peristalsis, which can lead to more constipation, thus more gas production and build up. So the things that you can do to help manage the gas production, the trapping of the gas, thus how painful that can become, is trying to address all of those things on various levels. So what you want to consider is, the first thing is, if you are taking any pain medications for either the incision from the cesarean or an injury to the perineum, that you reduce those pain medications as soon as you are comfortable. Have that conversation with your provider and see if you can start to wean off of those, switch over to something that is less potent, because pain medications can also contribute to constipation. So that's the first thing to think about. If you are going to continue to be on them, take stool softeners. It's okay to take an over-the-counter stool softener, especially if you are on pain medication. So chat with your provider about also taking a stool softener. The other thing to consider is wearing a belly band. So because your body goes from having this baby in there that takes up the space and creates all of this tensioning through the abdominal wall, once baby is no longer there, the abdominal wall is soft and squishy, and it's gonna have a really hard time creating the support that is necessary for your intestinal wall. So having a belly band, especially one that gives a bottom up support, like the bloomers from the company Bebe, which is actually developed by a physical therapist, you are then providing that external support that your abdominal wall isn't able to do quite yet. And it's not so much, it's not a corset, it's not a cinching sort of compression. So you can wear these really past the 6 weeks, and still have just a nice hug for the pelvic floor and for the abdominal wall. The other thing to think about is the lifestyle and the diet. So you want to make sure that you are eating regular meals, that you are eating meals that are easy to digest. And that may be like slow cooked meals, roasted vegetables, broths, things that are really easy for your gut to digest. Things that are harder are like cold foods, salads, smoothies. Those are harder for your gut to digest. So you want something that is super easy. The other thing that you want to do is, anytime that you eat, you want to make sure that you are chewing that food until it is mushy and soft, and because digestion starts in your mouth. You want to chew, and then before you swallow, take your time. Another thing to consider is not drinking a ton of water when you are eating. If you overhydrate, you can change how much acidity you have in your stomach, which can make it harder for your body to digest the food that you just ate. So drink your water, the majority of your water, away from when you are having your meals. It's okay to have sips, but don't do a big amount of water at that time. The other thing to think about is to stay hydrated. You really need to stay hydrated for your gut motility. Like I said, just have it at a different time than during your meals, but always have a water bottle handy, especially if you are breastfeeding, because you're going to need to drink more than even during your pregnancy. So stay hydrated. Okay, so then the other lifestyle stuff is movement. So of course you want to be really careful with how much movement you add in after giving birth. So you're not going to be getting up and doing a ton of movement, But what you can do is simple, really slow movements that start to get your pelvis to move a little bit and start to kind of massage your gut in a really comfortable, safe way. You can do that by staying in bed and doing pelvic tilts. So what that is moving your pelvis front to back, nice and slow, as if you were pouring water out the front of your pelvis and then pouring water out the back of your pelvis. You can also do circles with your pelvis. So as if you were drawing a circle with the back of your pelvis or with your pubic bone. Again, going really slow. I'm going really fast with my hands, but go slow. This is not something that is going to increase strength, but what you want to do is you want to connect with your body in a really comfortable way. You can do it with your breathing and really feel if there is any tension happening in your body, and so that you don't then quickly guard if there is tension or pain. You're going slow enough that you can be in a more controlled state. The other thing that works really nicely is, again, staying in bed, but doing really slow and controlled twists of your trunk. So one that I really like is staying on your side and slowly twisting back and then coming back forward. So you're lying on your side and you're just slowly twisting back and coming forward. And you can add your breathing with this for even more support. So have, those bloomers on. You can even be hugging a pillow to your belly. You can even be squeezing a pillow between your knees, and you're gonna slowly turn back as you're exhaling, and then you're gonna slowly come back, continuing to exhale. That exhale helps you connect into your core, which is going to provide some support even if you don't feel any contracting. So really slow, controlled twisting, not trying to go to a massive range, but just gentle, slow movement. The next thing is walking after meals. So again, you're not going to get out there and do hills. You're not going to do really long walks. But what you can do is in your house, stay on one level in the first few weeks, and just do little circuits after you've eaten. So instead of just sitting after eating, get up, slowly make your way around the room, maybe walk around a table, up and down a hallway, no stairs yet, but really slow and controlled, so that it can help you digest that food. The other thing that you can do is in the moment, if you start to feel that you have gas, is to actually hug your belly. So give yourself some support with that gas. Help yourself kind of move it through by hugging your belly with a pillow or just with your arms. You could tuck your knees up as well, and then do some really deep breathing. So you can breathe down into your trunk on your inhale, so you're filling the space, helping it kind of move through. And then when you exhale, think about hugging with your abdominal muscles, hugging with your pelvic floor. Again, that can help move it through. But that is more in the moment. And then the other thing to think about is don't ignore when you feel like you have to poop, because if you ignore when you feel like you have to poop, it can back up more. And so if you feel like you have to poop, go and sit on the toilet. Put your feet up onto a stool to help you with that poop, as well as if you have had a cesarean, or if it's painful at the perineum, put some bracing on those areas. So if it's a cesarean, again, hug a pillow or hug with your arms. If it is the perineum, take some toilet paper and place it on the perineum, bracing the perineum when you are pooping. The other thing to do is then exhale when you are pooping, so you're not holding your breath, you're not increasing that pressure in there, you're letting it all out when you are pooping, so that you don't have that build up, you're not backing up and potentially causing more gas. So the last thing to do would be to schedule an appointment with a pelvic PT, right? So if this continues to be a problem, definitely schedule with a pelvic PT. But also in those early days, pelvic PTs can be really helpful, especially those who are manually based. They can either come to your home or you can go into their office and help with organ positioning, help with scar care, help with muscle function. So if there is tension, if it's really hard for you to connect into your muscles, they can assist you with doing all of those things. But in those early days, especially manual based pelvic PTs are great for helping with organ position, getting that the kinks out as your body starts to normalize and find those positions that the organs are meant to be in, and move that gas along. So ask your questions in the comments below. Let me know if this happened to you, and if you did something that was not on my list and it really helped you, let me know, because we want to let other moms know if there are some simple ways that they can also help themselves during this. And we want to get this information out to as many people as possible. Subscribe again so that you also can keep up on more information for recovering in postpartum, especially when it comes to your pelvic health, and so that you can be as informed as possible about your body and what you can do. Thanks so much. I'm Dr. Ryan Bailey. I'm a pelvic floor physical therapist. I appreciate you watching this video.